On February 28, 2026, an unprecedented military escalation unfolded in the Middle East when the State of Israel announced a coordinated military strike against the Islamic Republic of Iran, immediately supported by the United States Department of Defense. The Israeli government described the action as a preemptive strike aimed at removing imminent threats, particularly related to Iran's nuclear and ballistic missile programs, a long-standing point of contention between the parties. In the weeks and months leading up to the attack, Iran and Western powers, including the United States, engaged in a series of high-stakes negotiations in Geneva and Oman seeking to curb Tehran's nuclear ambitions. But those talks ended without an agreement, with Iran refusing to agree to stringent limitations on its missile capabilities. On the morning of the strike, Israeli Defense Minister Israel Katz publicly confirmed that the military operation was underway, stressing that it was intended to remove threats to the State of Israel, and that the assault had been planned in coordination with the U.S. and prepared for months in advance. Early reports indicated that explosions were heard across Tehran and other major Iranian cities as missile and aerial strikes commenced, and early air raid sirens sounded in Jerusalem and across Israeli territory in anticipation of Iranian retaliation. The coordinated assault, internationally reported under code names such as Operation Lion's Roar by Israel and Operation Epic Fury by the U.S., began at approximately 9:27 Tehran local time, with missiles and bombs striking multiple urban and military targets, including areas close to Iran's political and security infrastructure. Iran's official media and independent observers reported thick smoke rising over key cities as residents documented blasts and emergency responses, contributing to fears of a broader war. The sudden onset of hostilities marked the most significant escalation in the region since the mid-2025 clashes, appending years of diplomatic engagement and drawing international attention to the fragile state of Middle East security. The multinational offensive conducted on February 28, 2026, involved a synchronized series of strikes on Tehran and other Iranian cities, targeting what military planners described as command and control facilities, missile infrastructure, nuclear-linked sites, and strategic leadership compounds. This phase of the operation drew intense global scrutiny and widespread media coverage. In Tehran, missiles reportedly struck multiple districts, including University Street and the Jamhuri area, as well as locations near the offices of the Supreme Leader Ayatollah Ali Khamenei and other central government ministries, according to local media and international agencies. Eyewitness visuals and videos circulated on social media, showing black plumes of smoke rising over central Tehran neighborhoods as air defenses engaged incoming projectiles, though there was no independent, immediate confirmation of the precise damage at all sites. Iranian official sources later confirmed that key infrastructure had been hit. Beyond the capital, explosions were reported in cities across Iran, including Kermanshah, Qom, Isfahan, Ilam, Karaj, Lorestan Province, Tabriz, Urmia, Bushehr, Damavand, and Shiraz, reflecting the wide geographic scope of the assault. Local media and international outlets described coordinated impacts on military and missile facilities. Among the most harrowing accounts, Iranian state media reported a strike on a girls' elementary school in Minab in Hormozgan province, which Iranian authorities publicly stated resulted in a large number of casualties, primarily school children, though international verification of exact figures remained difficult in the immediate aftermath. In addition to conventional sites, some of the strikes appeared directed at senior leadership and strategic command centers, while Iranian officials said the nation's supreme leader had been moved to a secure location. There were contrasting assertions from Israeli sources about whether he had been killed or was unreachable, a matter that remained contested in early reporting. The offensive's execution reflected precision, targeting alongside broader disruptions to Iranian airspace and civilian infrastructure, with emergency services and residents grappling with multiple points of impact amid rising concerns about further waves of conflict. In the hours following the initial U.S. Israel strikes, Iran responded with a large-scale missile and drone campaign aimed at military and strategic targets across the Middle East, marking a rapid expansion of hostilities beyond its borders and escalating fears of a wider regional conflict. Iranian missile batteries reportedly launched salvos toward Israel, U.S. military bases, and allied facilities in several Gulf states, with some of those projectiles intercepted and others causing explosions in urban areas, including reports of at least one fatality in Abu Dhabi, UAE, according to state news agencies. Several Gulf countries, including the United Arab Emirates, Qatar, Kuwait, Bahrain, and Jordan, moved swiftly to close their airspaces, citing security threats and airborne risks. and international airlines suspended flights to and from regional hubs as a precautionary measure. Bahrain's government reported that a missile had targeted the headquarters of the U.S. Fifth Fleet, which is stationed in the kingdom, calling the missile strike a treacherous attack and a violation of its sovereignty. Air defenses in other Gulf states engaged Iran's projectiles, with local authorities reporting multiple interceptions. Simultaneously, Iranian Revolutionary Guard Corps public statements framed all U.S. and Israeli assets in the region as legitimate targets, signaling that the retaliatory campaign would continue relentlessly until what Tehran described as the enemy's decisive defeat. The spread of conflict reached across national boundaries as missiles and drones were reported toward U.S. bases in Iraq and Syria, and Iranian strikes were claimed near Erbil in northern Iraq, where Kurdish authorities confirmed the interception of drone attacks. Israel and U.S. forces engaged defensive systems to intercept incoming missiles, and sirens wailed in Israeli population centers, such as Tel Aviv and Jerusalem, as authorities urged civilians to seek shelter amid fears of sustained retaliation. The rapid expansion of conflict dynamics demonstrated how the initial strikes had triggered not only a direct military exchange, but also a broader regional security crisis, with multiple countries grappling with the immediate effects of missile threats, airspace closures, and the specter of prolonged warfare. The human toll of the U.S. Israel offensive and subsequent Iranian retaliation began to emerge through state media figures, health agencies, and international reporting, even as independent verification was complicated by restricted access and ongoing hostilities. Iranian health authorities reported hundreds of casualties across affected regions. According to statements attributed to Iranian emergency services and state news outlets, over 200 people were reported killed and several hundred injured as a result of the strikes on Iranian territory, with significant numbers of civilian victims among the dead and wounded, including women and children in sites far from military installations. Among the most reported incidents, the strike on the Jazeera Tebe Girls' School in Minab, for which Iranian officials cited more than 100 fatalities and nearly 100 injured, highlighted the devastating impact on non-combatants and raised immediate international concern about civilian protection amid military operations. Hospitals in Tehran and other cities reported being overwhelmed with incoming wounded, while emergency responders worked under challenging conditions to evacuate injured civilians and treat trauma cases, often amid continuing air raid alerts and uncertainty about further attacks. In Gulf cities affected by Iranian missile strikes, authorities confirmed injuries and structural damage, and at least one person was reported killed in a blast near a major airport in Abu Dhabi, underscoring that the conflict's humanitarian effects were crossing national borders. Even in Israel, civilian areas faced disruptions and casualties related to intercepted missiles and defensive operations, though reported deaths were lower than initial figures from Iranian territory. Nonetheless, communities grappled with anxiety, displacement, and emergency measures such as shelter alerts and public warnings. Humanitarian organizations, including the International Committee of the Red Cross, issued urgent calls for respect for international humanitarian law, emphasizing the need to protect civilians and critical infrastructure as the conflict unfolded. Medical facilities across the region faced strains due to sudden surges in patients, shortages of supplies, and damaged transport routes, compounding the suffering of affected populations and prompting international appeals for aid and safe corridors. The extensive casualties and widespread destruction brought renewed attention to the human cost of modern military operations and highlighted the acute need for diplomatic intervention to prevent further loss of life. The international response to the February 2026 U.S. Israel military strikes on Iran and the ensuing conflict was immediate and deeply divided, reflecting global concerns about regional stability, international law, and the future of diplomatic engagement in West Asia. World leaders and multilateral institutions issued statements ranging from condemnation to calls for restraint. Russia condemned the joint U.S. Israel operation as a pre-planned and unprovoked act of armed aggression, accusing Washington and Tel Aviv of using Iran's nuclear program as a pretext for regime change and warning of the risk of humanitarian, economic, and radiological disasters in the region. Moscow urged an end to violence and offered mediation at the United Nations Security Council. European Union officials expressed deep concern over the outbreak of hostilities and called on all parties to exercise maximum restraint, protect civilians, and abide by international law, emphasizing that diplomatic efforts should be prioritized over further military escalation. The International Committee of the Red Cross stressed the need for adherence to humanitarian principles, warning of a dangerous chain reaction of military escalation with potentially devastating consequences for civilian populations across multiple countries. Several Middle Eastern states, while wary of Tehran's regional policies, urged an immediate cessation of hostilities and reiterated support for peaceful resolution through diplomacy. Oman, which had played a key role as a mediator in U.S. Iran nuclear talks, expressed dismay at the violence and called for renewed diplomatic engagement to avoid further bloodshed. Iran's allies and regional partners denounced the strikes, with senior officials framing the attacks as an assault on Iranian sovereignty and asserting that all U.S. and Israeli assets in the region were legitimate targets for retaliation until what Tehran described as victory. At the United Nations, emergency discussions were held as member states deliberated on mechanisms to de-escalate tensions and provide humanitarian assistance to affected populations, while analysts warned that the conflict's expansion could destabilize global energy markets and disrupt international commerce, especially in and around the Strait of Hormuz, a critical choke point for oil transit. Despite mounting pressure for a ceasefire, military operations continued in the immediate aftermath of the initial strikes, with both sides reinforcing their defensive postures and preparing for potential new rounds of exchange. The prospects for de-escalation hinged on renewed diplomatic negotiations, and many global actors called for an urgent return to dialogue to forestall further loss of life.